again, it's Mike Grafstein with Myolage, the grandchild of all soft tissue release techniques. In this third video, you'll learn about indirect myofascial release, direct myofascial release, soft tissue release, soft tissue mobilization, and we'll show you some video clips of the Myolage techniques. So what is myofascial release, the indirect method? Well, the indirect method involves a gentle stretch with only a few grams of pressure, which allows the fascia to unwind itself. The gentle traction applied to the restricted fascia will result in heat and increased blood flow in the area. This allows the body's inherent ability for self-correction to return, thus eliminating pain and restoring the optimum performance of the body. The indirect myofascial release technique, according to John Barnes, is as follows. Lightly contact the fascia with relaxed hands. Slowly stretch the fascia until reaching a barrier or restriction. Maintain a light pressure to stretch the barrier for approximately 3 to 5 minutes. Prior to release, the therapist will feel a therapeutic pulse, such as heat. As the barrier releases, the hand will feel the motion and softening of the tissue. The key is sustained pressure over time. Myofascial release, the direct method. The direct method of myofascial release or deep tissue work method works on the restricted fascia. Practitioners use knuckles, elbows, or other tools to slowly stretch the restricted fascia by applying a force. Direct myofascial release seeks for changes in the myofascial structures by stretching, elongation of fascia, or mobilizing adhesive tissues. The practitioner moves slowly through the layers of the fascia until the deep tissues are reached. Michael Stanborough has summarized his style of direct myofascial release techniques as: land on the surface of the body with the appropriate tool, sink into the soft tissue, contact the first barrier or restricted layer, put in a line of tension, engage the fascia by taking up the slack in the tissue, finally move or drag the fascia across the surface while staying in touch with the underlying layers. Exit gracefully. Soft tissue release. Soft tissue release is a technique where pressure is applied on the muscle or connective tissue during movement of the tissue to impart a stretch or lengthening. In order to maximize the effect, the pressure point is relocated during the stretch to impart the force through different sections of the muscle or connective tissue. Soft tissue release, the pressure. Pressure is applied through a lock or a glide. The lock is a fixed position. Thumbs, fingers, fists, palms, knuckles, forearm, or elbow are used. Soft tissue release, the stretch. The stretch should move the tissue from a shortened to a lengthened position, then back to a shortened position. The stretch should last no longer than 2 seconds to ensure the client does not experience pain. It's passive, it's active, and then there's an overpressure. And it's also done in multiple planes. There's more emphasis on the stretch than the pressure. Finally, soft tissue mobilization. Apply pressure to the tissue and ask for movement. Thumb, finger, knuckle, forearm, fist, or elbow are used. Works both on and in between muscle compartments. The Myolage techniques. The Myolage melt.
So now what I've done is I've run my fingers down from the attachments at the C-spine going towards the first rib, and I'm just what we call the Myolage melt, where my fingers are applying very subtle pressure and I'm just hanging out. And I actually feel that I'm sinking a bit here. So what you see right now can last anywhere 30 seconds, 2 to 3 to even 5 minutes until you start to feel your fingers sink.
The Myolage direct.
So now we're going to work on the forearm flexors and then the forearm extensors. There's a couple of different things we can do. Basically, again, it's just a simple thumb stripping in between. Straight up to the cubital crease there. Again, you can use your thumb. This is basic stuff that you've learned. You can get your knuckles in. And depending on
The Myolage lock and passive.
And what I'm going to do is I'm just going to apply pressure, so a bit of a Myolage lock, and I'm laterally rotate. Okay. And to add to that, I will now take it into induction.
The Miolage lock dynamic.
Okay, so now we're going to work on the suboccipitals. The first release is where we have the Miolage lock, where you take your thumb and your finger and basically squeeze. And at the same time now, you ask your client to, if you could, and if you could just bend forward for me. And as she bends forward, we get a bit of a stretch in the suboccipitals.
The Miolage direct dynamic.
We're going to make it more of a direct and active. So Sean, if you can extend and let it down. So the pressure movement as it goes down, back up, down, good, and relax.
This is Mike Grafstein saying thank you very much for watching these videos. Check out, we've got other videos on the go, and please visit rmt-ceus.com for more information.